Hi guys, welcome back on YouTube channel, and my name is Massimo, and today I'm proud to have a great speaker with me from America, Dr. Justin Kolnick. Hi Justin, how are you?
I'm well, thank you for having me here today.
It's a great pleasure. The point to have to stay with you today because I think that you have a lecture now today at in 2:30,
Correct.
Hall 1, and talking about a very interesting topic. Tell me the title.
Well, it's about lasers, laser-assisted endodontics, specifically the enhanced efficacy or effectiveness and how it streamlines the workflow.
That's perfect. So I think that is a good point to attend the whole one today at 2:30 because it's very interesting. Justin is from South Africa, but is living in America. He postgraduate in Columbia University, New York, and then is more than 16 years that is studying about laser.
Correct. Yes.
So it's not the first time for you. So I think that the topic is very well known. That's why it's interesting to get even better in this, deeper in this topic.
But it is my first time at ESE, so I'm very privileged to be here today.
That's fantastic. Thank you for coming. So the first question that I want to make to you, it's laser is not a new technology. I'm an endodontist too. I don't never use laser during my root canal. So my question is, why today? Because I met you for the first time, I should change my mind and start to use laser. I know that is a very big question, but because you're an expert, so maybe in a few words you can change my mind.
Well, I hope so, but the real problem with doing endodontic therapy is that for many years we've known that the root canal system is very complex. But ever since CBCT is now being used, we are thinking and we are looking in 3 dimensions. And the more we look, the more complex anatomy we see. And traditionally, with traditional instruments and irrigation, we've known our limitations, and we would rely on the concept of reducing the bioburden and then entombing the bacteria within the root canal system. And that was fine until we started looking at our cases in 3D. And we started to see many cases that looked successful in 2D radiographs, in fact, showed signs of disease when we looked at these teeth in 3D.
I see.
So now the need became greater for us to try and raise the level of what we do, and to, as a result of that, to increase the predictability of our treatment and to make everything more successful.
So that's true, but my question is, at the moment, nowadays we have about 90% success, about after root canal, even if it's a general dentist or specialist. So the level that we reach nowadays is very high. Why I need to increase maybe this 10% of success using laser? Maybe this can change my success rate. Another question, money-wise. Makes sense to invest a lot of money in this machine, these tools, to get this 10% or even if to increase the success rate of my treatment.
Right, so the return on investment on this technology is both financial and it is emotional, because this reduces significantly the amount of stress that endodontists or general dentists who perform endodontics are subjected to. Examples could be with managing calcified canals. We're now able to what we call recapitulate with laser energy. We no longer recapitulate or go back in with smaller files to unblock the canals. The laser energy allows us to recapitulate, it allows us to create and maintain patency and to manage these very, very difficult calcified systems. So the additional advantages is that by recreating patency, we're able to establish drainage and decompression of periapical tissues. And this becomes really important for us because many endodontists are moving towards the single visit model of treating endodontics. So this streamlines the process right from the planning stage all the way through to fewer post-operative complications, both short-term and long-term, and fewer treatment complications in multi-visit cases. In addition, we are now able to reach inaccessible and unfound anatomy in root canal systems. We're able to penetrate more than 1,000 microns into dental tubules and to all the ramifications like isthmuses, lateral canals. We're able to clean and disinfect these. In addition, the YSGG laser, the erbium YSGG laser, is an all-tissue laser. So we have significant advantages during surgery in managing soft tissue, in managing hard tissue. This technology provides a comprehensive treatment concept for us. So the return on investment is both financial because I'm now able to see 1 or 2 more working patients a day, but also at the end of the day, my day is much less stressful. So I think I'll live longer.
That's good, and I think also for the patient is an advantage, apart of course for the single visit instead of the multiple visit.
Yes, there is a significant advantage for the patients because in terms of post-op pain and discomfort, shorter visits, but you know, I think it's an interesting thing with patients. They're quite excited or enamored with lasers. You can mention all other types of technology you have in your office, but the minute you mention laser, they look around, they want to see the laser. So, but yes, I think all round, this is a device that allows us to perform endodontics in a much different way than traditional.
Yeah, that's a good selling point. If the patient is happy, we are happy, and then of course it's important to give the possibility. Apart joke aside, it's important to reduce the chair side, the chair time.
Correct.
And then in the advantage for the patient only. But I want to ask you another question because I do endodontics, root canal, and then after I'm happy to restore the tooth. And my memory, as far as I understood, the laser can change the dental tissues in the dental tubules. Do you think that this can affect the adhesion in the root canal? When we finish the root canal, we need to build up. This can change something in adhesion.
Well, yes, there's been quite a few studies to show that not only within the root canal system, but also in the chamber, there's a concept called bond prep.
Okay.
Where we use the laser to etch the surface. So if you are using a bonded composite type restoration, there's little need now for you to use acid etching. We can etch. So this becomes really important when we're doing a surgical repair of a perforation or a resorption defect, where we're not really keen on adding acid, which may come in contact with bone. So we're now able to etch the resorptive cavity with a laser and then go ahead and restore with a composite.
So that's great. So actually we can use the laser in 360. So from inside the canal, in the chamber, and when we perform a surgical approach. So that's
sure.
I think that this is a very, very good selling point. So I want to say really thank you for coming. Don't forget that today 2:30, hall 1, we have 45 minutes talking and then going deeper. I'm not sure if you're able to make many questions to Justin, but we will be there waiting for you. Thank you very much,
Thank you
Justin.
very much for having me. Thank you.
Bye then.
Bye-bye.